Hi, my name's Christine Tran. My student number is 16979866. Unfortunately, I don't have a student ID card, so I'm just going to present like this. Thank you. Clinical leadership in nursing is vital because it directly shapes patient safety, the quality of care, and team performance. According to Stanley 2017, nurses are often the first point of contact for patients, and our leadership behaviors, such as communication, advocacy, and decision making, and have an immediate and lasting impact on outcomes. Sorry. This presentation is a chance for me to reflect on my understanding of leadership in clinical practice and connect theory with real-world nursing environments. I am a clinical nurse educator on a busy medical surgical ward. And leadership for me is not just about teaching skills, it's about guiding, supporting, and motivating staff so that together we deliver safe, high quality care. Um, an overview of my slide. We'll go through the definition of clinical leadership, servant leadership in nursing, and what it's like in practical environments, attributes that influence and motivate clinicians, and a reflection or conclusion, how I ended it. So, a definition of clinical leadership. Clinical leadership in nursing can be defined as the ability to influence, guide, and empower colleagues to deliver safe, evidence-based, and patient-centered care. Patrick et al. Describes it as being enacted in day-to-day practice through role modeling, collaboration, and advocacy rather than the formal management roles. As a CNE, I show clinical leadership by mentoring, teaching, and supporting staff development in ways that empower them to thrive. Recent Australian research highlights that CNEs are seen as approachable, relational, and values-driven leaders who play a critical role in guiding new graduates into practice, even without formal authority. This closely reflects the principles of servant leadership. Eva et al. 2019 describes servant leadership as prioritizing the growth, well-being, and empowerment of others. By role modeling professional values and advocating for safe standards, clinical nurse educators demonstrate the servant leader's commitment to ethical responsibility, service, as the Royal College of Nursing also emphasizes. More recent evidence shows that servant leadership strengthens resilience and leads to a better patient outcome, according to Bayati et al. 2025. Servant leadership is about putting the needs of others first, supporting the growth, and building a community. In nursing, this means prioritizing patients, mentoring the junior staff, and empowering colleagues. On a busy medical surgical ward, servant leadership is visible in everyday actions, from empowering staff to make safe decisions to check in on well-being or advocating for safe workloads. Research shows that this kind of leadership reduces burnout and improves engagement. By role modeling calm communication and respectful practice, I set the tone for the team. Even small acts like helping with observations with busy post-op patients or guiding graduate nurses through prioritization that which strengthens trust and creates a culture where staff feel valued. These behavior foster teamwork and safe patient care. I chose the servant leadership as one of the favorable traits in nursing because it reflects the realities of nursing practice. Leadership in nursing isn't about directing tasks. It's about creating supportive conditions that allow staff to deliver safe, patient-centered care. Wong, Cummings, and Duchamp emphasizes that nursing leadership directly impacts both patient outcomes and team performance. Servant leadership emphasizes service, empathy, empowerment, which are crucial in environments where patient safety and staff well-being are at stake. Research shows this style improves nurse satisfaction, reduces burnout, and supports better outcomes. I connect with this style as this is how I am perceived on the ward and seen on the ward, and it mirrors the way I approach my role, collaborating, listening, and empowering others rather than relying on authority. As a clinical nurse educator, I've seen how approachable and supportive leadership can transform the confidence of new graduate nurses and motivate experienced staff nurses as well. Servant leadership is often described through traits such as empathy, healing, awareness, persuasion, foresight, stewardship, a commitment to the growth of people, and community building. It also includes practical behaviors like listening deeply, keeping an open mind, and choosing words carefully. Together, these traits describe the mindset of a servant leader. In my own practice as a clinical nurse educator, these are values I try to embody, but today I'll focus on just three attributes that I really believe that influence and motivate clinicians. The three are emotional intelligence, empowerment, and advocacy. So, going off with emotional intelligence, one of the most, why I think this is one of the most important attributes of servant leadership is that it's central. Basically, without emotional intelligence, you can't listen to staff. You know, nursing is already in a high stressful environment with and advocacy for well-being is a must. This motivates the team and builds resilience. Research by Bayati 2025 shows that servant leadership grounded in emotional intelligence reduces burnout and improves work, life, and quality. With empowerment, I'll add that there's another key attribute that is empowerment. I basically empower graduate nurses by supporting them through patient prioritization and encouraging independent decision making. This builds confidence, strengthens a team, and develops myself as a leader as well. Shao 2024 found that empowerment improves performance and reduces emotional exhaustion in nurses. And as mentioned, lastly, advocacy is also another attribute of this servant leadership. Advocacy means speaking up for safe standards through evidence-based care. For example, I encourage graduate nurses to participate in bedside handovers, giving them a voice and building their confidence. That I also support staff with new therapies such as Vyalev for Parkinson's patients, and I introduce by providing education, hands-on teaching. This all reduces anxiety, empowers staff, patients, and also ensures safety practices all around the ward. Studies show that advocacy and inclusive leadership foster trust, collaboration, and stronger clinical outcomes. Just another example of a servant leadership, according to Fidel, is that there's nurse-led cares and nurse-led models. So with nurse-led models, it's a care that basically shows an example of servant leadership. And these models are put together by nurses for patients at the center. Basically, nurses are leading with assessment planning and managing of care. They also improve access, affordability, and outcomes, thus touching and particularly looking after the vulnerable groups. The nurse-led models or nurse-led care reflect servant leadership because they prioritize service, empower nurses, and foster collaboration across healthcare teams. By putting patients first and equipping staff to lead, nurse-led care embodies the principles of using power and not to control, but to uplift others. Um, as I end this presentation, I just want to say in healthcare, leadership is essential for safe, effective, and compassionate care. One of Patrick et al. Argue that clinical leadership in nursing means influencing, guiding, and empowering colleagues through role modeling, advocacy, and collaboration. Servant leadership aligns closely with nursing practice because it prioritizes growth, well-being, and empowerment. By leading with emotional intelligence, empowerment, and an advocacy, CNEs like myself can motivate staff, strengthen teams, and improve patient outcomes. Ultimately, a clinical leadership is about service and serving patients, supporting staff, and creating a culture where safe, high quality care is always at the center. Thank you for listening. Just at the end, there's a reference. Thank you.